real easy peasy. You know, what you'll do is, of course, get one of those alcohol pads, you open, and essentially you'll clean your area off. So if it's in your waist, you'll just kind of clean this off and get that ready. One technique that we love to talk about is pinch this area hard enough where you'll feel some discomfort. So when you're slowly injecting the needle, your body's gonna focus on just the pinching, if you will, versus the needle, because it can only focus on one thing at a time. Now, once you actually get this open, okay, right here, here's our medication. And this one is essentially Semaglutide, got it, Semaglutide. And then essentially you're gonna take out one of your syringes. Now, based on where you're gonna start, once again, everybody's a little bit different, but let me just kind of show you what it looks like on the syringe. So the syringe is a really, really teeny little needle here, and you'll see it has increments of 10. So there's a 10, there's a 20, there's a 30, and a 40. Now, once you think of those as units, so one of the ways that we prescribe to make it real easy for you is 10 units, 20 units, 40 units. This actually has 2 points. This right down here is the needle, and this is the cap. So the cap comes off right here, and this of course goes back and forth. I suggest you do that before you take the needle off, so it'll be real easy. You will then, with your little Semaglutide right here, and remember we had an alcohol pad, you can get another one off, and just, you'll pop the top. Here's the little gray top right here. You'll just pop that top just like this, all right? And you'll see it has a rubber stopper. That rubber stopper you can actually wipe with an alcohol pad to help sterilize that. You will then take the syringe, the needle right here, and look at it. So make sure you know which one this is. So this one right here is set up, I hope you can see that, right at the 20, which you will then inject it in, up and down straight. Probably the easiest thing you can do is put it on a surface that allow you to push up against. So here's a little box. So you don't have to touch it. You put it on your desk here, put it directly in, all right? Then you will hold this, push the air through, and then draw off that syringe. So if you can kind of see what I'm doing here, I'm gonna try to get the numbers lined up. So this is coming right at the 20 units. Can you guys see that? So there's now 20 units in this particular syringe. Then what you'll do is you'll go ahead and grab that. Remember, we've already cleaned that area off. You're gonna grab that, push it really, really hard. Go ahead and actually poke that in there, and then inject it slowly into your skin. You see that right there? And that's pretty much it. Again, you also get this little container right here. You do not have to recap it. The easiest thing to do is put it right in there, and essentially you're done. And then close the cover. Call your provider so we can go over your dosage again, ask any questions, but hopefully this will help and get you started and what to expect. Hey, this is Dr. Dickerson, and hope to see y'all soon.